Hello, welcome to another episode of Cabot's webinar series, where we talk about technology and healthcare. Good evening, good afternoon, and good morning to all of you. Today, I have Ms. Rosie Scott, founder of Erin Health and OsteoV Clinic, and our topic of webinar is enhancing patient care, headache care with AI. I welcome you, Rosie, to this session.
Thank you, Indu. As I say, I'm Rosie. I'm an osteopath based in London. I usually deal with manual treatment, sort of musculoskeletal ailments, but I have a real specialism with headaches. And I've been working with Indu and the team at Cabot to develop a solution for a huge problem within the headache medicine field. So thank you for having me. I'm looking forward to it.
Yeah, thank you, Rosie, for joining the session. And I'm really excited to have you with us today. With that, I would like to go forward with asking Rosie my first question. I think, Rosie, it was a really exciting project to work with you. And I would like to ask you, what was your motivation in, coming up with this idea of triaging headache patients using AI?
Yeah, so because I'm an osteopath and I work in primary care, so typically I will see patients who have either just managing their headaches without any medical care at all, so looking into the internet, talking to friends and family, like getting really sort of bitty pieces of information that are often either not necessarily completely inaccurate, but just nothing is really connecting the dots. And even those patients who have been to their GP just doesn't really have the time, the perspective, or really the sort of ability to take a decent enough history to be able to diagnose them correctly and give them the advice that they really need in the UK, they have 7 minutes before they get booted out the door. So patients are often very weary they're wary of going to their GP, but they're also just tired and they just think, well, I'll just manage it myself. And I've been doing a master's with the Danish Headache Centre in Copenhagen. And with the rise of the speed that AI is sort of coming at us, I just knew that there was a solution out there to, narrow this gap and fix this problem, so that patients actually had the information that they really deserve to have, but also give the GPs and the primary medicine care teams the information that they need in order to create the right diagnoses, give the patients the right medications and things like that. So that was sort of where it came from for me, having that experience of patients being so overwhelmed and frustrated with the system, that I thought the system can change. So that's where we are.
Yeah, I think I remember you were saying it was like one of the motivation was to reduce clinician fatigue, right?
Yeah.
And as far as Cabot is concerned, it is one of our first application where we are directly engaging patients in the application, and with treatment we have worked with AI on document summarization on the clinician, and we have worked with document summarization or telehealth calling, OR scheduling, all those kind of application. But this is the first time we worked with collecting patient data, directly from the patient. So my second question is, did you have any concern about sharing this protected health information of patients with AI? What was your concern about?
Absolutely. And actually the regulatory landscape is probably only just starting to catch up in terms of the ethical implications, but also the data control implications of AI and how it gets used. AI is often seen by the medical field as a bit of a black box. You can't really work out what's going on with it, and so that is changing, not just within sort of the clinician aspect perspective of how AI is used, but also within the system and how it's integrated and how it is used intentionally rather than just sort of being used piecemeal. And actually doctors, and they are using AI, and actually that's probably a more dangerous place to be, where no one really knows what data is going in and how it's being used. So that was a really important consideration right from the foundation. Data privacy, how consent is received, and making sure that it's really, really well informed. And also the model that is used within the application there are all sorts of different models, and some of the bigger models, the way they've been trained, what kind of data is being used, are there any biases within it? That is all having an implication of how the data is analysed and how it comes out. So, and that in itself is a data sort of privacy and consent consideration. So, I know, Indu, that your team, you were really patient with me when I was being a bit persistent about which model we were looking to use, but it was a really deliberate choice, and I'm really glad that how well you've worked with them in terms of making sure we got all of that bit right. And as someone once said to me a while ago when I was first thinking about the concept, is you wouldn't want a Porsche with a 50cc engine, so why would you build an application with a model within it that isn't going to do the job that you need it to do? So the other things that we really considered were making sure that, other than the consent that gets taken right from the outset, is making sure where it's anonymized, so making sure it's anonymized at source, how it's stored within databases, and you patiently explained all the technological aspects of that to me, so that was also really helpful, and making sure it's separated so that the risk of data breaches is much lower, if not almost down to zero. So creating that foundation for a good application that is regulatory secure was really important. So
yeah, I remember that was one of your primary concerns when you approached us, and from our side, we also made sure that any personal information was kept separate in another database, and we also applied encryptions, and we ensured that the personal information is never passed. Only the clinical data of the patient gets passed to the AI tool. And and I know that we have a patient report as well as a physician report.
And I'll give you an idea. I'll share a screenshot.
Communication style has to be different. I think you had mentioned.
And having that, go back to the misinformation that patients often have, especially around headache care, because there is, it is so prevalent. And so there is a lot of data and information out there, some good, some bad, some good but misconstrued. Where can patients actually find accurate information? And they might pinpoint on some very medical information that is then misunderstood because the language isn't something that can be understood. So having with the application two outputs, where one is for the patient and one is for the clinician, so that the clinician has a really succinct summary of the important bits of information to allow them to make that clinical judgment and highlight any areas where there's information that is missing, was really important. It just allows that short consultation time to be used so much more effectively when a patient does come in. So with the patient output, the language is not it's not dramatic. It's giving accurate advice. Well, we'll find out with the validation, but accurate advice that isn't alarmist. It's telling them, giving them the advice of what to do and what their symptoms are in a way that they can understand them, with some generic advice and what to do next, so that they know what to do. They know they have the bit of advocacy that they can do themselves to go and speak to their work colleagues when they're struggling at work, or GP when they need new medication or things like that. But let me share here we go. So if I show you, this is just the dashboard that you would that within the system, you see. So this isn't something that is accessed by anyone else outside the company, but you've got a clinician report. So, and this is shared with consent, of course, where the information is summarized into very, very succinct medical terminology. It talks about the red flags, which is something that was is the main concern from a validation point of view. You know, is it safe? Which is something we're going through at the moment. It's got the differential diagnoses so that they can be considered within the clinical setting, and they just need to be looked at quickly. And then you've got recommended next steps based on the guidelines in the UK, you know, what's causing it, what they need to do, and then obviously some caveats of anything that's missing, anything that needs to be considered. And what the outputs have been really good at doing is summarising it appropriately. So this is then the patient report where the language is different. So it's giving much more of a sort of generic overview where it's simpler language and it's not overwhelmingly medicalized or anything that should be taken out of context. So it should be really, really comprehensive from that point of view. You know, we've got bolding where they need to so that they can really see the information quickly. Recommendations, we've got, you know, should they go and see their GP? Should they keep a headache diary? How lifestyle changes seem to be observed within their wider medical context. This is an example where there was a penicillin allergy, and that's brought into the consideration that they can go and use that information and know that their GP might need to know a bit more about it. And then some educational advice within it. So hopefully that gives you sort of a flavour of the two different styles. But it's to allow that advocacy for the patient, but reducing that friction for the clinician as well. Does that make sense?
Yeah, I remember that you were saying that the patient report should not have any, you know, complicated medical terms or anything, and less alarming and soothing it should be, but it should still convey the message and rush them to the doctor if it is required. Yeah, I remember that. How do you plan? What is the financial model you have planned for this application? I'm not clear how you plan that.
So it's a sort of multi-revenue stream plan. We've got obviously the end users who are the patients. And what I've just shared the screenshots of, that's just the tool that we've built at the moment. But the wider model behind it is a full management for patients to be able to go and access information that is appropriate to them. So having it hyper personalized based on this initial triage so that they know what's appropriate. Is it lifestyle factors? Is it hormonal factors? You know, with headache medicine, often there's a stage of life and it changes. It's not a disease that sort of comes because of one thing and goes because of another. There are so many things that crop up, and which ones of those are important for that specific patient. So having this sort of wider toolbox that patients can access, and, you know, specific exercises and things like that. So you've got the user, the B2C model where users can access some things that are free at the point of use, some that might be more specialized and paid for. And then we've got the B2B model whereby either you've got the health insurers providing having a license which covers all members to allow them to go through the triage tool and then access all the premium content behind it to keep their members supported. But ultimately, because for medical insurance, it always comes down to money, reducing the cost of GP appointments, because members do understand what's going on more. They're less likely to actually make a GP appointment in the first place, because there are a lot of migraine drugs, particularly, that you can buy in Boots or, you know, just over the counter. So it's much easier if they know what to go and speak to a pharmacist about, because pharmacists are incredibly knowledgeable. But it also reduces the referrals to specialists, so it's keeping those costs down. So it's reducing the number of scans that are being having to be paid for within the insurance and the specialist consultation fees. So, you know, even if you save 1% of the referrals to specialists, it translates to a huge cost saving, even based on the license fee model that's going on. So that's that sort of multi-stream. There is a third stream, which is looking at the pharmaceutical companies. They obviously play a big role within the industry in terms of research. And one of the things the wider model will look at doing is collaboration with clinicians, university groups, to create a research hub whereby we can utilise the data that's shared with consent, obviously, to create more and better research. And the pharmaceutical companies for this have a big role, because there's often a lot of funding behind it, because they either want to test their drugs in a third-party setting, or looking at how lifestyle or other influences might change and influence their medication outcomes, basically. So there's lots of the partnership plan is a bit of a future proofing plan, but the B2B and the B2C model is something that is going to be really important with the growth of the business.
Okay, yeah, I remember you were saying like eventually we will have multiple versions of the report taken by the same patient, so you can record the progress of the they are making.
Yeah.
Right. Okay.
Exactly.
Yeah, I remember that. Okay. And you were Rosie, you also mentioned that these kind of tools will be useful, in remote areas where there are scarcity of clinicians,
and
like Africa.
That is one of the biggest issues with lots of medicine, but headache medicine in particular, is there just aren't enough specialists to cover the population of the world. I know migraine alone is 15% of women, 8% of men. It's not an uncommon disease. It's designated by the World Health Organization as the second most disabling neurological condition for women. And not having enough specialists means that there's a huge swathe of the population that don't understand their own bodies and how they work, and what access to help and what help they should do and should be looking for. And so, the fact that this is online, obviously at the UK, and at the moment, the iteration is just for the UK, and getting the regulatory model and all the sort of boring aspects in the background, right, but making this a much more global application, so that areas where the healthcare system is really, really sparse, means that even if the access to the medical specialists is still really limited, the understanding of their own condition, and maybe the access to just the basic drugs and medications, some of them are on the essential medicines, most of them are on the essential medicines list. So 90% of migraine sufferers should be able to access the first line abortive drugs, so the ones that are going to be useful in the event of a migraine attack. So it's really important to be able to widen the scope of access to healthcare within headache medicine, and I truly believe that with this application, that opens the door slightly, so that people can have something that is trusted and hopefully validated, and so that they can look at building systems based on the fact that patients then have knowledge and they have the advocacy to be able to ask for the help that they need.
Yeah, I remember that we made sure that the application is clearly visible and in the mobile as well.
Yes.
Yeah, so that the patients can take it from anywhere, and also they can, partially fill it and keep it. And
that's a really, really good feature that has been commented on in all testing, is the taking a headache history takes time, and the pressure to do it all in one go, even whether that's in the GP where they don't have the time to do it, or in the application, knowing that they can literally stop mid, they don't have to save a page, it's just an autosave, means that they can come and go within busy lifestyles, internet connectivity problems. It's not going to be a problem. So that was a really important piece of the puzzle as well. So I appreciate
I hope it works out well, and
at the moment it's working well.
And become global.
Yeah, I hope so too.
Yeah. one other question is like now that you have started using the application and you feel confident about the agentic AI outputs, it is coming out well, right? The recommendations and everything.
Yeah, so far so good. I mean, there's always some tweaks that will go along in these early validation stages, but I have two major clinics who are going to be doing their own validation in the future. So close future, thankfully. There's a couple of tweaks, but so far it's picking up everything. If anything, it just picks up some things a little bit too much. But that's always going to be the case with an early tweak, with an early iteration. But so far, the outputs have been really, really impressive. And as I said earlier, particularly with taking the patient as an individual and as a whole construct, not just their medical information, but looking at the social aspects. So I take one young girl who was still at school. It had recommendations about talking to teachers and creating an environment at school that would help a long-term management of her headache disorder. So, and that was something that wasn't an intention initially in this stage, and was going to be sort of a more sort of long-term intention of how to education around living with a disease like migraine. But it's been amazing that it's already being picked up within that. So I'm really, really pleased about the agentic features within it. Yeah.
Good to hear that. Yeah. And I know we also talked about, I mean, right now our form is web-based. It doesn't talk to the patient. And I think one of your vision was to make it a voice.
Yes, agent. Absolutely. Yeah.
And so can you talk a little bit about your plans of expanding on
this? I have so many plans. So certainly the voice recognition and the actual ability to chat, obviously with something like a headache disorder, actually looking at a screen can exacerbate it. So having that option for patients not to need to look at a screen and they can just sort of phone up and sort of talk to their headache assistant essentially to get the information that they need and impart the health data that they that the platform needs to give them that personalization will just allow for more and more personalization and really, really in-depth insights to what will be helpful for them. I really believe I want every patient to come away from a visit to the platform feeling like they've had 2 hours with a specialist headache neurologist. Well, that's the aim anyway. But yeah, the more personalization it can give, the more valuable it is to that patient. And the more useful it is to the clinician who can see exactly what's going on really, really quickly, and then has time to talk about all the other aspects and, education of how to take particular medication or integrate any other comorbidities and things like that. But yeah, the voice recognition is a really big feature that will be that is within the plans for the next couple of years and development of the tool. So, but also, as an actual application rather than just web-based, is having that option for patients as well is really, really useful. So yeah, there's more.
I hope you get when you validate the current phase and you come back with expanding plans.
Yeah, me too.
Good luck with that.
We're getting close. Yeah, no, we're really close to finishing the first phase of validation. So, and it's really exciting to see the results as they're sort of coming through. So, yeah, I can't see us not being able to progress. So, yeah, it's great. It's an exciting time.
Yeah. Okay, I think with that we come to the conclusion of our today's webinar, and we are open to take questions from you. Please type in any questions in the Q&A window. Okay, I think I have a few questions, Rosie. If a person has more than one type of headache, do they need to fill the form twice? Like, can they have multiple kind of headaches?
They absolutely can have multiple types of headaches. So the system is the application is set up so that it asks that question, and it asks a certain number of the questions twice, so that you can really sort of separate the two. One of the problems with headache diagnoses is all the symptoms get muddled together. So it's designed in order to pick all of that apart, so that you can get two or more distinct diagnoses, or understanding of what's going on and what's causing one and what's causing another, or what's influencing one and influencing another. So whilst that initial questionnaire aspect to it takes that little bit longer, the information that comes out should be much, much clearer. And certainly with the validation that we're going through at the moment, that's the one thing that people have really valued, is that they've recognized, oh, this is more than one type of headache. And actually sometimes they might think there's four different headaches going on because they present slightly differently, but actually it's just a manifestation of one disease, typically migraine. So they're getting what they think is four different types, but either they're being triggered by slightly different things or preceded by slightly different symptoms, but actually it's all just one type of headache. So the platform is designed to pick apart whatever is present. So absolutely, you can have more than one type of headache, just it takes a fraction longer in that initial phase. But once that's done, that's done. So yeah.
Yeah, I remember that the form is pretty exhaustive. It has, questions for female patients, special questions for female patients, and other different questions for aged people and people with special conditions like cancer.
Yeah,
who have gone through chemo.
Yeah, and it's one of those
are considered.
It's one of those considerations where, there's a explosion of in the medical AI field. And one of the things that has been picked up quite recently is that if it's just agentic without a background of what questions need to be asked for specific diagnostics, some of the bigger models are leaving out key questions that really do change an understanding of what's going on and maybe some safety implications of it. So they're coming out with actually not as accurate pieces of information. They're really, really good at the really, really niche diagnostics, but the micro or specific models are much, much better at that. So as well.
Oh, okay. I had actually one more question. So these kind of applications, do you think we can adapt it to other, settings like emergency care? Or,
I do think so. I do think so, and actually it exists already in lots of the things, especially with where pattern recognition is a main driver of diagnostics. So the imagery, radiology is a big area of that. I don't think it's the bigger models that will really break through. I think it's where either the bigger models have been trained into sort of a micro niche, or where there are specific medical models out there to really understand where the data that they've been trained on in as a sort of in the whole is on accurate data. Some of the bigger models, they've got data coming in from Reddit feeds, so the information that's coming out is not accurate at all. So it really does, at the moment, the magic happens at the micro AI, where platforms are built with a specific goal in mind. And the agentic information gathering at the moment, I don't think is good enough. And certainly the results of some of the or the reports of some of the results in these big AI testing isn't as accurate. And quite rightly, clinicians are very, very hesitant to implement them and use them. And I don't think they will never take over their clinical judgment, but what it can do is really reduce the friction. So wherever there's pattern recognition, there should and will be an integration of AI. And certainly with any kind of patient data gathering for a specific niche, I think will be really, really useful to have that AI create that data pool that can be used by a clinician to make it the final clinical judgment. So there are lots of fields of medicine where it will be really integral into it. But at the moment, I think it's still working out how that works and making sure it's safe. That's where the regulatory implications are catching up, rightly so. They should be so, yeah.
Yeah, that's true. So you think that with the AI to help us, the headache care can take, much higher leaps to make the patient's life a lot better than what it is now? Like, how do you see it, like from 10 years from now, do you think?
I see it, I genuinely see it transforming. There is a lot of pattern recognition in headache medicine. It's just having enough data to be able to do it, and then translating that data into something that's useful for the patient, that isn't just drink more water or take a paracetamol at the beginning, because that's, the generic advice is useful in some instances, but it's really not helpful when, if you take something like migraine, it is a hugely disabling disorder, and it's not just a headache. It is the brain fog that lingers afterwards for up to, a couple of days afterwards. It's if you're getting an aura, visual changes, sensory changes where you've got pins and needles. Some people get speech problems, yawning, cravings. It really does impact. You cannot just push through a migraine attack. It's a severe pain and other symptoms that last not just an hour or so when you take a paracetamol and it's gone. It will last for hours. You have to go to bed, go to sleep, and just wait for it to go. But there is help out there. There are really effective medications, but there is also a lot of non-pharmacological things that can help. But unless patients know about them, they don't know what's worth the sort of investment of time and money, because some of these self-help things, they're really expensive, and the evidence out for some of them is good. The evidence for some is terrible. Likewise, supplements, there are hundreds of supplements that will say it helps with this or that or whatever. Which ones are actually going to be useful to that patient specifically? And if the platform also already knows that they've tried, say, magnesium or coenzyme Q10, and they found no effect, being suggested that they use it is not only frustrating, but it's really harmful for the trust of that patient to know, okay, they really understand me. So that's where I really believe that headache care and medicine in general really needs to go. It needs to be super personalized so that patients aren't just repeating themselves over and over and over again, which is what happens throughout all healthcare niches. But specifically in headache medicine, you go through an hour consultation and then you get referred and you go through the hour consultation again. And that's demoralizing and a waste of everyone's time. So, let's reduce the friction and everyone's happier.
So you are saying that with this AI, we are able to give personalized medicine to the patient. And
absolutely.
About the physician, do you think the doctors would need any training to use this tool?
Yeah, I mean, with any technology, there's always an element of how is it implemented. But again, this was part of the foundation that I remember having long conversations with you about, Endu, because integration, particularly in healthcare, is typically with the electronic health records. I mean, some systems don't even use electronic health records. That is much more of a barrier. But with the platform that we've built, that patient summary, that alone can be a standalone piece of information that a patient can take in order to advocate for themselves. So whilst a clinician might need to read it in the moment of a consultation, it does at least reduce some of the information gathering that they need to do in that session. But integrating with these electronic health records, some get used really comprehensively. There's lots of information in there. So the problem at the moment is that information, is it good data? Can you actually integrate with it properly? So the way I wanted the platform to be set up is that so as little integration as possible needs to happen. All it needs is that interface to be able to push the clinical output to the patient's records so that the clinician can see exactly what's going on, literally with a touch of a button. And there's some integration that will be happening with a sort of interface company to allow that to happen. That's their specialty, is integration with electronic records. So that's where the foundation is in place. But yes, in theory, anything new technological comes up with some resistance because clinicians are asked to learn new systems left, right, and centre. With this, I didn't want that. I wanted as little as possible with that. So just literally one touch on that patient's record with their clinical summary, which goes into the data fields that it needs to go into, and then it's there. Yeah.
Okay. Yeah, thank you, Rosie, for explaining it well.
I hope it made sense.
Yeah. So I think we can conclude this session. Thanks a lot, Rosie, for joining this session.
Thank you for having me. It's been really enjoyable. I hope it's been helpful as well.
Yeah, thank you, and have a wonderful evening.
Thanks.
Thank you all.
Thanks
Thank you. Bye.